It seems like months of almost radio silence when it comes to COVID news, but recently we've seen an uptick in the number of cases in Louisiana. Some experts say the signs are pointing to a sixth wave. Here to talk us through all the possibilities is Dr. Joseph Cantor with the Louisiana Department of Health. Thank you so much for joining us.
Thank you. It's my pleasure to be with you.
All right, so why are some people worried about a sixth wave?
Because we are in one, to be honest with you. So we've had, up until this particular wave, 5 surges of COVID-19 in Louisiana. This is our 6th surge, and there are some similarities to previous surges and some differences. The similarities are that there's a lot of COVID being spread right now. Transmission risk across the entire state, all 64 parishes, is high, meaning for people that go about their daily lives, that congregate, that do what they want to do, the risk of being exposed to COVID is significantly higher now than it is when we're not in a surge, which means you're going to be exposed. People are going to be exposed. The other side is that on average, people are not getting as sick with this wave of COVID as they have in the past. And that's a good thing. We're not at risk of overwhelming our hospitals the way that we were in prior surges. Now that's just an average. It doesn't mean that we don't have small numbers of people that do get very sick, and unfortunately, we haven't yet had a day where we could report 0 deaths. So small numbers of people do get sick, but not in the larger numbers that we've seen in the past, and that's reassuring news for most of us.
So what is making people sick right now? Is it Omicron? Is it a subvariant of Omicron? What is it?
It's still Omicron, but it's a subvariant of that, a cousin of the initial Omicron strain. So right now we're dealing mostly with 2 subvariants, one called BA.4 and one called BA.5. We're actually ahead of the national average on this. So nationally, about 81% of new cases are from the BA.4 and BA.5. Here in Louisiana, we're at about 85%, and that's what's driving this surge. If it wasn't for those 2 variants, I think we would have peaked and already come down this surge, but they're continuing to drive spread.
Why this variant, and why is this variant happening now?
You know, it's difficult to predict these variants, and it's difficult to know which ones are going to take off and become variants of concerns and really affect us. These 2 subvariants, BA4 and BA.5, have unfortunately proven to be the most transmissible variety of COVID that we've seen yet. It's highly contagious, more contagious than other varieties. Again, the good news is it's not typically making people as sick as other varieties, but it certainly is causing cases to go up.
In the past, whenever we were dealing with these waves, cases would go up after big events like Christmas, Thanksgiving. Is the 4th of July at all to blame for this?
I don't think it helped, but I wouldn't blame it on it. We were surging before the 4th of July came in. Really, it's an issue with timing and when these variants come up and how transmissible they prove to be.
So I know you said a little bit about hospitals already, but that's been a huge concern with all of these waves. Are our hospitals prepared?
They are prepared, and they've had a lot of practice, unfortunately. They are prepared. On one hand, we've increased by more than double the number of COVID patients in hospitals over the past month. On the other hand, it's a small fraction of what we had been at this point in prior surges. We've got about 600 or so hospitalized COVID patients across the state. At this point in prior surges, we were at 2,000 or 3,000. So thankfully, we're not anywhere close to overwhelming hospitals and threatening our ability to receive care for COVID or otherwise.
And part of the reason why the numbers at hospitals are going down is because of the vaccine. So is getting a booster something that can help with this 6th wave?
Yeah. So this is what I'll say. If you're eligible to get vaccinated or to get boosted, do that now. If you've been vaccinated but not yet boosted, do that now. That will add significant protections. About 95% of Louisianans across the board have either been vaccinated or had COVID or both in the past. And while that's not 100% protective, that certainly is significant, and that's one of the reasons why, on average, our cases, thankfully, are mild right now.
Are a lot of those cases reinfections?
They are. A lot of them are reinfections, and one of the things we're seeing with BA.4 and BA.5 is the protection you get from a prior infection is not as robust as it was at earlier points in time in the pandemic. So unfortunately, we're seeing a lot of people who were infected as recently as a couple months ago get reinfected now, and that's something we just have to grapple with.
All right, so we know about boosters, vaccines, and these types of variants. Is there anything else people should know about this latest wave?
Yeah, we have a lot more tools at our disposal to protect ourselves and protect our families than we did earlier in the pandemic. You can get vaccinated, get boosted. It's easy to get those shots right now. You can get a high quality mask, like an N95 or a KN95, very easily. They're available online. That wasn't available that way earlier in the pandemic. They provide excellent protection. And if you do get infected and you are high risk for complications, meaning you're older or you have significant underlying conditions, there's good treatment. Paxlovid is a great treatment. There's other treatments available too. So there are options to keep you out of the hospital if you are infected. What families should know is, first and foremost, take a risk calculation. If you think you or your family are higher risk, take some precautions, be judicious with your indoor settings, wear masks when you can. If you do get infected, talk to your doctor as soon as possible, because if the treatment's right for you, it could keep you out of the hospital.
All right, thank you so much for coming in and talking to us about all these possibilities. Again, Dr. Joseph Cantor is with the Louisiana Department of Health. Thank you so much.